Hi guys, how are you? Today I'm going to discuss about a condition called as fibromyalgia. A lot of people may not be aware about what is the fibromyalgia. So let's start. I'm Dr. Shah, consultant rheumatologist in internal medicine, NHS UK. So fibromyalgia is basically a diagnosis of exclusion. We have to rule out a number of the conditions and then finally we assume this is the condition which is called as fibromyalgia. Unfortunately, there is no absolute test at the moment which can diagnose this condition. Like a lot of tests or scans are available right now who can diagnose different conditions. So what happened in the fibromyalgia? There is typical generalized body ache, or you say multi-site pain, pain in the upper body, pain in the lower body, that remain more than 3 months time. Then associated with this, there is a significant sleep issues and significant tired, extreme fatigue. So if these symptoms can remain more than 3 months, then one can go for assessment with the primary physician. And obviously the primary physician send a referral to the rheumatologist nearby. Why we rheumatologists do see this disease, this patient, or we can diagnose such condition? So primarily we do have a patients like rheumatoid arthritis, lupus disease, ankylosing spondylitis, and numerous other inflammatory conditions. Now those patients who have associated fibromyalgia, 15 to 22% of all these disease patients do suffer in some part of their life is fibromyalgia. So that's why all the primary surgeries, primary, physicians from the GPs, they tend to refer to us. Now we have to rule out a number of conditions. For example, we have to do a full blood count to rule out any anemia. We have to do vitamin D to rule out any low vitamin D, B12, folic acid, thyroid conditions, inflammatory muscle conditions, all the autoimmune conditions. And then once all the results, if there is a deficiency, we obviously treat vitamin D, we have to give the vitamin B12 replacement. If there is a hypothyroidism, if there is anemia, so one have to treat all the baseline or any deficiencies. Assuming that all the blood tests negative or means normal, then we used to label. There are certain tender areas when we do the physical examination. Obviously there is no any inflammatory signs. The people do tend to think about this is the pain which is coming from the wrist, this pain coming from the multiple ribs, back pain, thigh pains, but obviously all the structures underlying like the bones, ligaments and everything are nearly normal. So what happened in this condition? This is basically a problem in the CNS, central nervous system. The epinephrine, which usually inhibit the pain, epinephrine is one of the neurotransmitter, or you can say a chemical in the body, which usually inhibit the pain in our body, is more or less is reduced. And the other substances, obviously this is difficult for the normal people, but there are different substances in our brain, in our body, you can say hormones, chemicals. There's a substance called as a substance P and glutamate. They are increased and they are basically to make a more pain in our body. So this is basically a disturbance in our central nervous system, and then these transmitters is spread in the body, and then the body is perceived more pain, even a slight touch, trauma, and that is a vicious circle. If you have a pain in the day, your sleep is disturbed, your next day is tired, so this cycle is going again and again. So fibromyalgia is usually every 20 people in the community do suffer fibromyalgia. It's more common in the women, 7 into 1, so 7 times more common in the women. And the age is around 15 to 55, so it's like 20, 30s and 40s is the most common when this disease or this condition usually happen. Now, there are certain trigger factors, risk factors, or you can say certain people have a tendency. Somehow, we don't know exactly, but there may be a genetic tendencies, and then there is an environmental or, uh, external factors. For example, there are a number of the factors. If there is a childhood abuse, trauma, post-traumatic stress disorder, if there's the death of a family or loved ones, if there's a broken marriages, difficult relationships, and if there is any physical trauma, road traffic accident, major surgery, in the women's difficult labor, birth, or cesarean section. So all these things can sometime lead to have acquired future in life fibromyalgia. Certain viruses in the lifetime, Epstein-Barr virus or some other viruses, if acquired, then they may have to develop this condition. Although this is a non-organic condition, but the triggers more increase after certain viral infections. Now, along with this condition, some people have a more somatic other conditions like a migraine, IBS, some bladder problems. Some people have a difficult like intercourse, relationship issues. Some people have a more dizziness. So these are the additional somatic disorders which usually additionally acquired. Obviously, more than 60 to 70% of the time, people either have a prior anxiety and depression that ultimately lead to fibromyalgia, or fibromyalgia and depression can coexist. So this is all about, in terms of what is the fibromyalgia. So for fibromyalgia, we need to see face to face. We have to listen the patient. We then examine to rule out any swelling like synovitis, any obviously other concomitant, pathologies. Then we order these number of the blood test. Now we advise full blood count, ESR, CRP, liver function test, thyroid function test, CK, vitamin D, B12, folic acid, then rheumatoid factor, anti-CCP, ANA. So these are the routine and all such relevant investigations we have to do it. And if they all are normal, then correlation with the history physical examination and all such blood tests. Even we do sometime x-rays. And then we say, this is all about fibromyalgia. So in this video, I'm just, briefly, or you can say this is extensively, this is all fibromyalgia. Hopefully the next video will be the treatment, like the lifestyle or what is the medicine available. So if you like this channel, kindly subscribe. Thank you.